So we're going to be talking about COVID. I hope that's what everyone's expecting. And this concept that it's been around now. It's been around actually for about 6 months, but been here in the U.S. strongly for 3 months. And we've learned enough about it that some of the things that we started off doing, like just going in our houses and really trying to limit any exposure, we sort of moved beyond that. And now we have this thing that we call the new normal. But what does that new normal really look like? What does it mean for me personally as I try to navigate this life and really stay safe? A lot of us have chronic diseases. We have things that we feel like are certain risks. We're older. We have other things that we're worried about. So we really want to stay safe, but we also want to live our lives in the best ways possible. So that's what we're going to be talking about. And I'm going to start with some patient stories and some data, and we're going to sort of mix those and talk about that. And then we have 3 prevention recommendations. So 3 things that we can do in this new normal to make sure that we don't get COVID ourselves, or at least decrease the risk. Nothing's 100%, but there are things that we can do that will decrease our risk dramatically. And then the last slide is going to talk about things that we can focus on that not only will prevent, but also will protect us as we go out into life. And again, I just want to remind everyone what Jay already said, which is that we want to have this as an interactive session. So if you have questions, please feel free to be asking these questions while I'm talking. So this is the first graph, the first piece of data that I want to show. And it's very interesting. You know, COVID started back in March. That's when COVID started here in the US back in March. That's when we first got our first few cases that we were able to document. And you can see in California, there was not much going on from a COVID perspective at all in the early part of March. Partly through March, it started climbing a little bit. That's when Gavin Newsom gave the shelter-in-place order. And you can see it gradually climbed through the first part of April. And then it seemed to level out. And I remember back there in the middle of April, I was thinking, oh, well, this is great. We have just a little small rise, and now we're starting to go down. But then you can see it stayed level there, went up actually a little bit more in April. We came to May, and it's sort of held steady in May, maybe a gradual increase in May. And then you can see June, it's steadily going up, and look what's happened in just the last few days. This is a slide that I literally downloaded today. So the new cases in California seems to be spiking right now. So it's actually scary. It feels like from a news media perspective and a shelter-in-place perspective, we were most worried back in April, but if you look at the new cases that are being reported on a daily basis, we're easily twice the number, more than twice the number now than we were back in those times when we were so scared. So this is a very real thing. COVID is around us. It's very much in our community. We still need to very much be figuring out how to protect ourselves from this disease. Now, I will say I did not put in the graph of the deaths from COVID. It's a flatter graph. So this graph shows a clear upspring in the number of cases. The number of deaths is a little flatter. That's partly because we have a little more ability to treat it. We've learned a few things as far as treating it, partly because it's probably going now a little more into younger populations. And as we know, the older populations are the ones that have the higher risk of dying from it. So I wanted to share a couple stories. When COVID was first showing up in California, in our practice, we said, we're not going to have any of our patients have COVID. That was our goal, to have no patients at all ever get COVID. Now, obviously, that was an unrealistic goal, and we realized that, but we like to shoot for high ideals, and so that was our high ideal. But we have so far had 2 patients who got COVID. Luckily, both of them have done well, and we'll talk near the end of the presentation about some of the things that we do that we feel like helps our patients do well in this illness. I just wanted to tell the stories of both of those patients because I think it's representative and symbolic of some of the things that we need to be thinking about as COVID runs through our community. So I'm not using real names, I'm not using real pictures, but these are stories that literally come from our practice. So the first patient, Maria, she lives at home with her sister. So there's just two of them in the household, she and her sister. They were fully isolating. So they heard Governor Newsom's orders. They took it seriously. They stopped going out to grocery stores. They stopped doing anything, but they both worked. And our patient actually worked in an assisted living facility. And this was relatively early on. This was probably around April 20 or so. She called us and she said, you know, I've got a little fever, I've got a little cough, and I'm a little worried. So we brought her to our office and we tested her for COVID-19. We do COVID-19 testing in our office. And sure enough, after 3 or 4 days, her test came back and it was positive. So she had COVID-19. So the first question is, where do you get that from? So this was back before masks were becoming a real big deal, but we knew she'd never really been out any place other than to her work. And we also knew at that point that there was increased risk for COVID-19 in nursing homes and assisted living facilities. So we determined that she got this infection while she was at work. So she was in an indoor space. She was working closely with these people, so she was breathing the same air that they were breathing. She was obviously using some protections, but she didn't think any of them had COVID. And so she wasn't using all the protections that you would use if you knew someone had COVID. And she was exposed to enough of the virus that she developed it. So we followed her closely. We made sure she had an oxygen saturation monitor at home. We talked to her every single day. And again, at the end of the slides, we'll talk about some of the more specific things that we'd asked her to do. But over the course of 10 days or so, her fever went down, her cough resolved. She was really tired at the end of this, but she gradually got better. And now she's actually back at work and she's doing fine. So another patient of ours, this one also just lived with one person, but the person she lived with was her husband. And they were also socially isolating. They weren't being quite as aggressive as the first one. This patient came down with COVID towards the end of May. What happened with her is she would allow a few family members in. But she only allowed a few family members in, and she tried to understand that their risk factors and really keep this concept of a social bubble available. But her husband would sometimes leave the house and go out shopping, and he would use public transportation when he did that. So he, you know, the assumption is that this happened after he was taking a bus trip. He tested positive for COVID, and before they realized what was going on, you know, she had not been socially isolating from him, obviously, and then she tested positive. He was not our patient, but she was our patient. She tested positive, and so we did the same thing with her. We gave her an oxygen saturation monitor. We talked with her every single day. We used some of the other items that we'll talk about towards the end of the slide presentation. And she did well as well. And so she's now also asymptomatic. She's not having any cough or shortness of breath, and she's back to her normal self. So we can see two examples here. One person who got it with close exposures at work. Another person who was in the general area, you know, inside a bus is the best guess as to where where he got it, but in the general area where people were positive. And as we know, there was a period of time in Riverside and Redlands, where our two offices are. And if you look at Riverside County and San Bernardino County, which is sort of the general area, the Inland Empire area where our offices are, there's a period of time where masks weren't required in those areas. So people could be riding the bus and not wearing a mask, and that can make a difference in exposure. So what we know about COVID, and these are things that we've really just learned better and better over the last 3 months, is that it's primarily spread through respiratory droplets. So back in March, we were very afraid of COVID spreading on surfaces, that it was going to get on something, it was going to sit there, say a railing on the set of stairs, or a button that you have to push in an elevator is going to sit there. We were going to touch that button, and then we were going to touch our eyes or our mouth or something, and the COVID virus would get into us that way. Now, it still can get into us that way, so we still need to use good hygiene and good precautions, but it's very rare that COVID gets that way. It almost always comes to us through little respiratory droplets, and these droplets come just from breathing. There's little respiratory droplets, and that tiny little virus, which you can see blown up in a big picture here on the right-hand side of this slide, those little viruses will be in these respiratory droplets. We'll breathe them in. They'll go into our face, through our nose or through our mouth, into our lungs, and then they'll start multiplying. We also know that the more of those viruses that we are exposed to, the more likely we are to get the disease. So our body has, assuming that our immune system is relatively strong, our body has the ability to handle a few of these viruses, and we can sort of kill them off and move on through life and never really know that we were exposed, never really know that the virus actually got into us at some point. But if we get enough of them, they tend to overpower our immune system, and they can start taking off, and our immune system just can't keep up. So it primarily comes through respiratory droplets. It's very connected to the amount of these respiratory droplets that we're exposed to. And your overall health also makes a big difference. And we're going to talk about this towards the end. One more graph, set of statistics here. This is sort of following up on the last bullet point in the previous slide, which is that your overall health affects your chances of getting the virus. So on the left-hand side is data from China. And what you can see there is this is the percentage of people who died who had pre-existing conditions. And you can see if you had no pre-existing conditions, it was 0.9% chance of dying. So not very many people actually passed away from COVID-19 if they had no pre-existing conditions. But if they had heart disease, and you can see diabetes, respiratory diseases, high blood pressure, and cancer, a much higher percentage. So as many as 10 times as many people would die from if you had heart disease as if you had no pre-existing conditions. On the right-hand side is the same kind of data from Italy. So you can see here, if you had 3 or more pre-existing conditions, so if you had heart disease, diabetes, and high blood pressure, for instance, close to 48% of the deaths were from people who had those pre-existing conditions. Now, if you had no pre-existing conditions, you can see there's barely anybody who had no pre-existing conditions who were actually dying from COVID-19. So it makes a huge difference having these pre-existing conditions. And of course, that's something we're excited about at Lifestyle Medicine, because we actually feel we have tools and resources to help people with pre-existing conditions and to actually get rid of some of them, which is a new concept in medicine, is actually getting rid of diabetes or getting rid of high blood pressure. But that's one of the things that we work on in our practice. So this is data from the US, and it's basically saying the same thing as that previous slide said. The Centers for Disease Control says that people with diabetes were hospitalized 6 times as often and died 12 times as often as those who did not. So again, these pre-existing conditions are bad news from a COVID-19 perspective, but they are something that we can do about. Okay, let's go on to the guidelines. So as I said earlier, I have 3 guidelines that I'd like to share with you today. The first guideline is know who you're getting close to. So create that social bubble that we talked about earlier that Joy had created. Create that social bubble, create those people that you're comfortable being close to, but know them well. And knowing them well means knowing several things. One is, have they been sick? Are they sick now, or have they been sick? So these need to be people that you know well enough that they're going to tell you if they're sick, and you can ask them anytime you want. You haven't had a fever, have you? You haven't been coughing, have you? And not only know if they're sick or if they've been sick, but also know what exposures they've had. So if they went off to the beach and didn't wear a mask, then you would know that, and you would decide how you interacted with them based on their recent exposures. So hopefully the people that are in your social bubble are people that are being careful, that are taking the precautions that we talk about here, so that you track what's going on with those in your social bubble, and you decide how much you're interacting with them based on that. So how big should your social bubble be? Well, everyone, it'll be a little bit different, but it probably shouldn't be very big, and you need to be careful even within that social bubble. But guideline number 1, know who you're getting close to. Now, we all know that sometimes if we want to have any kind of life whatsoever, we're going to be around some people that we're not, that aren't in our social bubble, that we don't really know. So this may be we're getting gas for our car, maybe we're going grocery shopping. There's a variety of scenarios that maybe we're out walking in the park, and we're going to be closer to people that we don't really know. So what's the guideline then? This is the same guideline that we've had from the beginning. Keep 6 feet away. And why 6 feet away? Because 6 feet is about how far those respiratory droplets will travel. So when you're talking, when you're doing your regular breathing, those respiratory droplets, they go out and then they sort of fall to the ground, but they don't go out much more than 6 feet. Actually, 6 feet is sort of the maximum. Now, if someone's coughing or sneezing, those respiratory droplets can go even further than 6 feet. So hopefully you're not around them, because you know, they're not even out. If we're coughing or sneezing a lot ourselves, we shouldn't even be out in public. But for people who are out, try to stay at least 6 feet away from them. So what that means is you're not really going to places where there's large crowds. I hear stories and I see pictures on the news of places where large crowds are developing, and I just shudder inside, because we're really not in a place in our country and here in Southern California where we can handle being in crowds. So guideline number 3 is wear a mask in public. And I just want to go through the little cartoon here on the right of this slide, because I just think it's so great. It gives us an understanding about masks. Masks, I recognize, are controversial. There's a lot of people who don't like the idea of masks. To be honest, I don't like the idea of masks. I despise wearing a mask. It's not what I want to do. But in our office, we wear masks all the time. When I'm out in the grocery store, I wear masks because it's the right thing for me to do. It protects me, as well as it's the polite thing to do for other people. But the little cartoon here says it shows 2 people, and neither of the people have clothes on. So they're people running around naked, and it says if we all run around naked and someone pees on you, you get wet right away. So that's what happens, you know, with our pets and that type of thing. If they pee, things get wet right away. But if you decide to put pants on, and the other person's still running around naked, if they pee, some of that pee will get through, and so we'll still get some exposure to that, but not as much, because there's a little protection going on there. But if the other person's wearing pants and you're wearing pants, then if they pee, the pee will stay mainly with them, their pants might get a little wet. If you're really close, there might be a little bit of rubbing. You might get a little wet, but generally you're protected. So this is a nice, in my mind, it's a nice humorous visual that really highlights the value of masks. If one person's wearing a mask, you're a little bit protected. But if both people are wearing it, and the most important thing is the person who's peeing, or in this case, the person who has COVID, if they're wearing a mask, the chances of that getting out is a lot less. So this is why we wear masks, is plain and simple. We're just trying to keep those respiratory droplets inside, and it's an important thing to do. So again, you don't have to like it. We don't have to feel good about it, but it's the polite thing to do, and it's the right thing to do to protect ourselves. So those are the 3 guidelines, and I don't think it gets much more complicated than that. First, know who you're around, and just keep track of them, be protected of them. When you do go out into public, try to keep the 6 feet apart. If you're in a place where you think you might get closer than 6 feet, definitely wear a mask. If you're just out in the park and you're more than 6 feet away, you don't have to wear a mask in those settings. Only when you get closer than that 6 feet does the mask really become important. So again, just as a reminder, there's lots of questions that I'm sure you might have. We're going to be answering those when we're done with the slide presentation. And we're almost done with the slide presentation. So just a couple more slides. So I didn't, as one of my core guidelines, I didn't put down washing your hands, using good hygiene, but that does matter. So we still want to be thoughtful of that and protective of that. We do want to keep a clean environment. We want to do everything we can to decrease the chances of COVID getting a foothold in our area, in our space. And then because we've learned over time that most of the transmission of COVID is through the air, through respiratory droplets, thinking about the ventilation in the rooms that you're in matters a lot. I think this is especially true if you're thinking about sitting in an office space for a period of time, or going to church, or anything where you're increasing your risk a little bit. So in those scenarios, understanding the ventilation of the place that you're in is very important. But again, I don't feel like it's safe at this point to be in a situation in an indoor environment where there's a lot of people around. It just feels unsafe to me, the way I understand this virus and how this virus spreads. So this is the last slide that I really want to spend some time on. We talked about chronic disease and how people with chronic disease have many times higher percent chance of dying from COVID-19. So in our practice, we're called Lifestyle Medical, and we spend a lot of time thinking about chronic disease and what we can do to not just prevent chronic disease, but also to treat it, and also to actually reverse it, to actually take someone with diabetes, actually get them off their medications, and actually get them diabetes free. Now, we can't do that with everyone, but it's actually more doable than you might guess or might realize, or that the medical community has actually talked about in the past. But we're getting more and more data, and we have plenty of stories in our practice where we've actually helped people achieve these goals. So how do we do that? We do it by applying what we call the 4 pillars of lifestyle medicine. And you can see them listed here: nourishment, movement, resilience, and connectedness. You can also see pictures of them. So we don't have time in this talk to go into the details of what these are. But just very briefly, nourishment, what that's about is primarily eating lots of vegetables. And for COVID-19, we talked about our 2 patients. We encourage them to eat lots of vegetables and also lots of fruits, specifically vegetables and fruits that were high in vitamin C. So these are things like your dark green leafy vegetables, These are things like blueberries, things like kiwi fruit. These are high in vitamin C, and that's good for us at all times, but it's especially good for us if we're at higher risk for COVID-19 and we feel like we've had an exposure, or we're just doing something that doesn't have our risk close to zero. And then we also talk about no processed foods, so things that are high in fat and sugar. These are deleterious to our health. These are actually one of the biggest drivers of chronic disease. Chronic disease, diabetes specifically, was not really around much. If you look 40, 50 years ago, diabetes type 2 didn't exist much. But now, depending on how you calculate it, as many as half the population has either diabetes or prediabetes. So this is primarily because we're eating more processed food. So to reverse it, we have to actually decrease processed food. So that's the nourishment pillar. Movement pillar, that's regular aerobic exercises, strength training exercises, and we talk about the environment. I mean, it's very good for us, especially during COVID, to be outside and exercise outside in the fresh air and the sunshine. We use the term resilience, and resilience is talking about sleep and stress management. So we recommend that all of our patients get 7 or 8 hours of sleep every night, and we like to give them lots of tools to manage their stress. Stress is a normal thing. During COVID, it's a very prevalent thing. Most of my patients have some stress at some level because of COVID. COVID's a very we like to have some control in our lives, and with COVID, we don't feel like there's a whole lot we can control. It's a very challenging time, and for a lot of people, that's stressful. So having tools to manage that stress makes a difference. And then our final pillar is connectedness, and we think connectedness is very important from both a horizontal perspective, meaning we have to have good family and friends who are supportive and who help us get through things, but also from what we call a vertical perspective, meaning we need to have a sense of purpose and a sense of meaning in our lives. Otherwise, we're more likely to get disease. So all of these are evidence-based. We know that if we are balanced and pursuing these in the manners that science has shown is valuable to pursue them, that we'll have less in the way of chronic disease. And again, as we apply these correctly, if you have chronic disease now, we can frequently actually reverse that chronic disease, actually get you off of medications. No promises, no guarantees, just saying that it happens more frequently than you might guess. So that's the end of my presentation. Just a few things here to finish up. Be proactive and take measures to protect yourself. If you want more information, feel free to schedule a consultation at Lifestyle Medical. We're still accepting new patients in both our Redlands office and our Riverside office. Feel free to contact Brand New Day and learn about the advantages of the Brand New Day Medicare Advantage plans. As I said at the beginning of the presentation, we're very happy with the things that we're allowed to do with this plan. So feel free to contact Brand New Day or us for further questions.